As a parent myself, I know nothing is more terrifying than your child having a fever. In the first few years of life, little ones can have 6 to 8 infections a year, and most of them will be accompanied by a fever. Parents often have a lot of misunderstandings about managing a fever, which can be harmful for their child. I'm Dr. Gina, and over my 15 years career as a paediatric doctor, I have managed and treated thousands of children with fevers and helped teach parents evidence-based steps to successfully manage common childhood illnesses at home. In this video, I'm going to explain 5 essential steps you need to know and use each and every time your child has a fever, and highlight the common red flags indicating your child needs to be seen by a doctor or health professional. Did you know that fever is a natural and healthy response to infection? It allows your child's immune system to fight off infections. Each infection is helping your child's immune system develop and become stronger. Children's temperatures can also rise during teething, after vaccination, and if they overheat. Anything above 38 degrees or 100.4 Fahrenheit is considered a fever. The best way to measure the temperature in a baby is using a thermometer under the arm. Ear thermometers are not very reliable in children less than 6 months of age. For children over a year, you can use an ear thermometer. Avoid rectal thermometers as they can cause trauma, and forehead thermometers as they are not accurate. In children, viruses are the most frequent cause of infection. Our own immune system fights off viruses and antibiotics will not work. Occasionally, your child may have a bacterial infection and antibiotics may be needed. Children recover very quickly from viruses, and with these 5 essential steps, you can help your child get better at home. 1. Regular fluids. Give your child lots of fluids to drink. This will stop them from getting dehydrated. If they are not eating, then offer diluted orange or apple juice to ensure they are getting adequate sugar and salt and not just plain water. Alternatively, rehydration sachets can ensure they stay hydrated and keep their sugar levels up. Water on its own will only stop dehydration. I have seen many kids admitted to hospital with dangerously low sugar levels because they've only been given plain water. If they are managing to eat, choose bland, high-energy foods like toast and cheese crackers. Their bodies will be working very hard to fight off the infection, which takes up a lot of energy. They will need to rest as much as possible to help them get better quickly. Avoid play dates or interactions with other people. This will also prevent them from picking up other viruses whilst their immune system is working hard. Prevent overheating. Keep your child cool and avoid dressing them in heavy clothing or too many blankets. Do not let them get too cold either, as this will cause the small blood vessels in their skin to constrict, preventing excess heat from the fever escaping, and this will actually increase their fever. If your child has fever or is distressed and is over 3 months of age, you may give your baby infant paracetamol, 4 to 6 hourly, and a maximum of 4 doses in 24 hours. If they are having plenty of wet nappies and have no underlying kidney issues, you may also use infant ibuprofen, 6 to 8 hourly for maximum 3 doses in 24 hours. Always follow the correct dosing instructions on the bottle. The medicine is primarily to help them keep comfortable during the fever or illness. Space these medicines out throughout the day and never exceed the maximum dose in 24 hours. Check on your child regularly, including nap times, and ensure there is an adult with them at night when they are asleep. Do not let them sleep alone as they may get worse, have a seizure due to the fever, or vomit and choke overnight. Occasionally the infection can be bacterial, or your child may need extra help to fight off the infection. The following are red flag signs, and if present, you should have your child seen by a doctor or medical health professional urgently. Firstly, if your child is less than 3 months of age and has a fever of 38 degrees Celsius or above, they must be seen by a health professional immediately. Very young babies do not cope as well with infections and can deteriorate rapidly. You should also consider having your child checked over if they are between 3 to 12 months. Your doctor will be able to give further advice or may want to monitor your child until they are better. A fever for more than 5 days. A very high fever shows your child's body is working hard to fight off the infection. With most viruses, the fever will start to come down after a few days. If your child is still having a fever after 5 days, they must be seen by a doctor for a thorough assessment. Dehydration. If you cannot get adequate fluids into your child, then they will need to be assessed and may need help keeping hydrated. Signs of dehydration are reduced wet nappies or the soft spot on the baby's head feeling sunken or depressed. Any worrying change in appearance, such as looking pale or flushed, or any worrying change in their behaviour, such as being very sleepy, floppy, irritable, or crying constantly. Any signs of a stiff neck. You may notice your child is hesitant to move their neck, or they may be complaining of neck ache. A rash which does not disappear with pressure. Many children get some sort of a rash with viral illnesses. Whilst most of these are nothing to be worried about, a rash that does not disappear with pressure must be seen immediately. Problems breathing. Any signs of increased work of breathing or strained breathing. Seizure. If this occurs with a fever, this is called a febrile convulsion. It is caused by a sudden rise in temperature which can cause their body to shake and twitch. If your child has a seizure, call an ambulance immediately. In the meantime, place them on the floor and on their side until the ambulance arrives. Most children get worse over the first couple of days and then start to improve. If you feel your child is not improving and getting worse, then have them reviewed. Most infections are self-limiting and children recover very quickly. Ensure your child is fully vaccinated as per their childhood immunisation schedule to help prevent serious diseases. We can't stop our children from getting ill. Picking up infections is a vital part of helping their immune systems to develop when we are young. Even though fevering children can be scary for parents, using the above steps and knowing when to call for help will give you the confidence to help you manage your child no matter how many infections they pick up. Dr. Gina Parenting is an evidence-based learning platform which analyses the most common issues that parents face and delivers correct and accurate information based on clinical research and evidence. This empowers you as parents to make the best possible parenting decisions for your child based on information that you can trust. To check out more videos, please subscribe, like and post a comment. Please visit my website to download your free parenting guide for 1 to 5-year-olds. If there's an interesting topic or something you would like to see covered in a video, please let me know. Thank you.